Hello and welcome to Taiwan Talks. We're bringing you the latest news and analysis from a Taiwan perspective. I'm Yin Khvat. Today we're looking at how artificial intelligence is transforming the future of healthcare. But perhaps it's not in the way you think. From movies, we're used to AI robots like Sophia.
Hello everybody, I am Sophia. Let me introduce you to my sister Grace. Come over here.
But the main way AI will deliver innovative solutions is through analyzing big data from patient records. We'll find out why this is revolutionary. I'm Yin Khvat. Our guests today are Ted Chang, Chief Technology Officer, Vice President and General Manager of Quanta Computer. Known as the world's biggest laptop and computer maker, he's also APEC Business Advisory Council representative and visiting scientist at Massachusetts Institute of Technology, Computer Science and Artificial Intelligence Laboratory, and Jack Lee, Distinguished Professor at Taipei Medical University. He's also the President of the International Medical Informatics Association and dermatologist at Taipei Municipal Wanfang Hospital. And earlier, I speak with Andrew Zeng, Grape King Bio Chairman and CEO, who has a PhD from the University of Strathclyde, United Kingdom. Dr. Chang, Dr. Lee, thank you so much for joining us today. But first, let's look at the big picture. We are living in a world where people are surviving for longer. Every part of the world is experiencing growth in both the size and the proportion of older persons in the population. By 2030, 1 in 6 people in the world will be aged 60 or over. That's 1.4 billion people. By 2050, that number jumps to 2.1 billion, or 12% of the world population. The number of seniors 80 years and above is expected to triple by 2050. Dr. Chang, so
Yes.
AI is transforming healthcare, but
Yes.
before we get into how, let's talk about the 2 drivers that you have identified. One is our aging population, as well as pandemics like COVID.
Yes, these are the 2 biggest problems and issues that the whole healthcare industry are facing right now. The reason for we need a new AI as a new tool to resolve that kind of situation is that AI can do it more by doing less, so that we can solve the resource problems that aging populations cause. The other thing is that for the pandemics, it created new needs and the zero contact technologies and also environments that needed to enable a new healthcare and environments to make things happen. To do that, we also need AI to create a smarter environments for the patients and also for the doctors. Yeah.
So the zero touch, you said from the pandemic, because we wanted to reduce the chance of transmission.
Yeah, and in that, more than that, it's very important that for aging populations, we need to consider how to do aging in place, which means that there is no enough wards or hospital or nursing center can host all the aging populations. We move the point of cares from the hospital to the home. So it creates a distance, but it also creates the needs to connect the people from home environments to the hospital.
If I could bring Dr. Lee in. So can you explain to our viewers, perhaps who are not so knowledgeable about big data, how is it that AI is using as a tool, you said, big data and helping doctors?
Yeah, actually, AI was an old concept. It's been in place for like 60 years already. But one specific type of AI is called machine learning AI, which depends on data. And big data weren't actually available before the internet. Right? So after the internet, and then the evolution and revolution of electronic health record in the hospitals, we're starting to have big medical data. That's where we are actually surprised by how good it is using machine learning AI to understand the medical problems and actually solve medical healthcare problems for us.
How does machine learning work, Dr. Chang?
I think
That sounds fantastic.
the first thing is that we created data that was too huge for people to read and understand. We need machine to read the data for us. So we need a very powerful, the machine to store the data and to compute the data. The second thing is that we want to convert, the human intelligence into artificial intelligence through, labeling, to put your understanding of the data as a labeling, annotation of the data, to do the training. And the training model is people nowadays use digital neural network to do the training. Then you come up with the result. You can do inferencing, you can do prediction, etc. So that's a very simple process of machine learning.
It's a little like if you teach a student many examples of the same disease. For example, you give the student many different cases of the same disease.
Maybe looking at images?
Images, lab data, examination, symptoms, and all that. The student will get to learn a general concept of what the disease will be. And then you repeat that process for many other diseases. Then the student will learn more diseases, right? But because the human learning, there's a limit in the capacity, and of course there's a limit on speed. But for computers, you can just keep that process, repeat the process, over and over again to 1 million times, 1 billion times, and the machine will still, the computers, i.e. the machine, will still be learning as efficient as it was the first case.
So Dr. Chang, is it sort of digitizing the process of decision making?
Yes.
Yes. Let's summarize just for the this end of this segment. Top level, the benefits that AI brings to healthcare, according to your perspective.
I think from my perspective, there are at least two things. First thing is that when we are talking about smart medicine or smarter healthcare, we have to think about one thing: what is the definition of smart? Many years ago, I raised these questions to the famous director of Lab of Computer Science in MIT. He told me that doing more by doing less is smart. It's the fundamental part of smart. So basically, we need artificial intelligence, AI, to solve some regular problems that the doctors don't want to do it over and over time again and to repeat it. And that's one of the things that AI can do. The second thing is that AI can provide more precise, the prediction and also diagnosis based on the data they have. And so that's another thing. So one thing is, doing more by doing less. The other thing is, getting your, result even more precise than ever. And based on that, you can do predictive and also preventative and also personalize, the medicine for the future.
Doing, achieving more by doing less,
yes,
as well as precision. Dr. Lee.
We cannot afford the future of healthcare actually in its current pace because of aging population, because of the advancement in all the healthcare technologies. Humans are incapable of handling all that, and we don't have the money to pay for it, right? That's why a lot of automations and smart processes will have to be introduced into healthcare to revolutionize healthcare, or we don't have a healthcare in the future. So I think if you ask about what is the most important benefits, I would say it will have to bring the cost down with the quality not getting worse or even better.
So basically, if we don't use AI and all these new technologies, we will essentially die from our aging population and all the diseases the modern diseases that we have.
Exactly.
Okay, thank you. Scientists say artificial intelligence is increasingly transforming the way we diagnose diseases. These researchers at University Hospital Zurich have enrolled AI to help analyze thousands of images of prostate biopsies over the past 15 years. Up to 50 biopsies are produced for every patient. The AI system is reported to slash the time taken to identify tumors from the images with an accuracy of over 99%.
1.5 hours looking at slides, screening all these slides, instead of just signing out the 2 or 3 positive ones, and taking into account that there may be a 0.1 error rate, this will pay off because I can do in 1.5 hours at the end 5 patients.
That was Peter Wild from University Hospital Zurich. Dr. Chang, so we saw the researchers there in Switzerland, and they said precisely what we said earlier in the earlier segment. Now, you have an IT background, whereas Dr. Lee has a medical background, so we're very fortunate today. And you are, of course, in charge of technology at Quanta. You've said, quote, "Data is the new fuel of the future and the cloud as the combustion engine." So in this segment, we want to go into a little bit more detail and use, practical examples. Can you explain Quanta's vision for smart medicine?
Yes, thanks for these good questions. I think under smart medicine, I think our vision is we try to enable an environments, the so-called smart medicine, anytime, anywhere, for anyone at any age, through cloud computing, through AI, and also through the future connectivity. And to do that, of course, you will use a huge amount of new data, not all traditional data, because new devices at home or new connected devices like IoT wearables, they will create a huge amount of data that traditional hospital or medical system cannot offer. So to do that, you will need a new cloud, customized for the new medical environment and also for artificial intelligence usage. And the applications are so broad that we need 2 kinds of people to work together. One is from the IT side. The other is that we need to understand more about what that physician, medical doctors really need in their environments, and also what the patients really needs. So it's all about how to redefine the medical problems or healthcare problems, and use problems to define what you need around the AI and what kind of software you need on the platform, and then to consider what kind of hardware infrastructure you need. So it's a big industry in the future in the order to solve the healthcare problem in the right way. Yes.
Dr. Lee, you you have the medical background, and one of your companies offers telemedicine. So can you explain how this fits into AI and technology?
Okay. One of the reasons that current healthcare is unaffordable is because we're trying to build larger and larger buildings, so everyone have to travel to that specific building, which is a hospital, to get everything done, right?
So it's what Dr. Chang was saying about anytime, anywhere.
Exactly. So now we can order things without going out of our home, and food can be delivered to our home, right? So why can't we have healthcare that way, right? If we can Uber everything, why can't we not Uber healthcare services? So the concept is that there's a first line and a second line and a third line healthcare. So the first line healthcare is just AI on your smartphone or on the internet that you can just use anytime you want. You can ask questions, you can have some examination, some simple screening, or even some consultation. And if that's not enough, then you go to the second line, which is an online consultation with a clinician, right? So it could be a senior nurse or a physician. And if that's not enough, that doesn't solve your problem, then you go to the hospital or the clinic, physically, in person. That way, we would at least cut 50% of all the physical travel to the hospital and clinic. Not only that reduce all the traffic, reduce all the carbon footprint, but also it's much more efficient, because some people would actually delay their disease because they don't want to see a doctor. They don't have time to do that because they have to take several hours of vacation and they have to travel, and the traffic is very bad, and all that, right? So if we look at telemedicine like any other modern service, it should be revolutionized to like Uber, as convenient as Uber, right?
Dr. Chang, so I understand that you in Quanta are working with something that you have coined yourself called artificial intelligence of things.
Yeah.
And you're working with 37 hospitals.
30,
Yeah.
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 Yeah. So one of the things that we try to do is that you can see that in the future, the point of cares will move from the ward inside the hospital to outside of the hospital. So inpatient home care or hospital at home is getting more and more important. But in the future, you will need more wearable, devices or based on the IoT technology, Internet of Things technology, so that you can provide continuously monitoring of a patient at home. So it's not like a health check just for one time a year. It's, you are trying to, attach something to the patients, keep collecting data.
24/7.
24/7. And so it's very important that you connect the data, you collect it, and to a powerful engine, just like the cloud, so that you can host the data, the big data you created, but you also can create a new algorithm and also new AI as a new services out of the data you collected.
So that's
yes.
the internet, that's where IoT comes in.
Yeah, AIoT,
because
yes.
there's a follow-up action.
Right.
Right.
Right. So you can see that if AI or the new algorithm is actually the value of the data, then you have to make sure that you have a good pipeline to connect, the data to AI, the IoT to AI. And so we simply, put the two terms together. We call it artificial intelligence of things.
Okay. Dr. Lee, if I wanted to continue on the theme of what you said about cutting the number of patients to hospitals by 50%. So this is a form of triage, isn't it? It's
Yes,
triage away from
triage, yes.
away from hospitals. That would be phenomenal. I mean, we can think about what would have happened over the pandemic if this sort of thing was in place.
Exactly.
Right. When could we see this sort of new system of healthcare?
Well, actually, during the peak of pandemic, in the U.S., in the United States, 40% of all the outpatient visits were replaced by telemedicine already. And now it's down to like 15%, but it's still much higher than the original rate, which was 0.4%. So I think it demonstrates that it works. But it takes a while for the patients and the doctors and the whole ecosystem to accommodate to telemedicine. Especially older people, they still want to see their doctors. They like to talk to their doctors. Maybe even chatting make them feel better. So it takes a while, but I think we're gonna get there sooner or later. COVID-19 has actually made it sooner than later for us to get there.
And so one of the things would be, people in rural areas that, maybe there's only one doctor in the entire town. So it basically helps with equity, isn't it, of access?
Exactly. I was in Mongolia doing a teledermatology project. And Mongolia is a very big country. It's probably as big as USA, but with only 3 million people living in a very big area. So when someone has a disease, they have to see a doctor, they have to travel like a week to see the doctor and then come back. And all their cows and sheep will be left behind, with no one to care about. So they would rather bear the pain of the disease than seeing a doctor. So we implemented a system, and everybody likes it a lot because they don't have, it cut their travel. For us, to see a doctor is probably a 3-hour, 4-hour travel, but for them it's a 3 days, 4 days travel. So that actually cuts the travel very significantly.
Dr. Chang, let me ask you, so we spoke about the growth drivers of this area, of this market. Do you worry that you are, and we talked about how AI can help with that decision making for doctors. Are you at all concerned that you might be putting some doctors out of a job?
This is very good questions. I think basically, medical doctors cannot be replaced by AI, but the jobs, the certain works can be replaced by AI. So currently, based on the technology evolution. But if you are only, working on certain job, you are defined by the job, you might be replaced by AI.
Okay, let's talk to the doctor.
Well, I wouldn't worry about it first because we're working longer hours now, so there are more burnout.
Yeah.
They call it burnout because the doctors and the nurses, they're just working on too many shifts. They have to work day and nights. So I think AI will first solve the burnout problem. And we probably will not need as many doctors as we have in the extrapolation if we successfully use AI in healthcare. But if we don't, we probably have to convert a large proportion of our population into medical service, which is probably not a good thing. Everybody's working in a hospital, right? So I think that AI is going to make it a little bit normal, back to the curve, that a appropriate proportion of the people will have to go into the health service, but not like most of them, right? Because in the future, we need a lot of healthcare service capacity, which we don't have right now.
Okay, thank you so much. Now we take you to Spain for another example of how the Internet of Things is being used, this time in helping fight fire. You can see here firefighters being fitted with an AI-based monitoring device during a prescribed burn. The device has sensors that monitor temperature, smoke concentration and humidity in real time and can send color-coded alerts to command centers. That information can then be used to pull firefighters out if the situation gets too dangerous.
Sí, nos estamos dando cuenta de que cada vez pues hay más o que somos más conscientes de que estamos delante de un elemento tóxico en el cual, primero, lo que tenemos que hacer es identificarlo, es decir, qué es lo que nos está pasando, qué es la concentración de humo, cómo nos está afectando el monóxido de carbono, y a través de todos los sistemas del software que se ha desarrollado Prometeo, poder decidir pues eso, cómo estará ese bombero dentro de un tiempo, si lo podemos utilizar, lo podemos apartar.
Dr. Lee, if I start with you first. So what we saw just now was outside of healthcare, but obviously we can see the clear linkages. That technology was provided by a Spanish startup, and you have one of your companies, ESOP Technology, has been selected for the Mayo Clinic platform. Can you tell us how much excitement is there in the market over startups, and how important are they to this industry?
I think there is an exponential growth of the number of startups, the accelerators, the venture capital that help this process. The reason that we started ESOP is actually to echo the machine learning because we have big data. Now, because we have big data, we need AI. We need more AI because, for example, in Taiwan, we prescribe 300 million prescriptions, with drugs and medications, 300 million prescriptions a year. And if we need someone to review the 300 million prescriptions, you will have to probably double the healthcare cost, right? But if we don't, there is a 5% error rate in the medication, in the prescriptions. And you don't want to take wrong drugs. Nobody wants to take their drugs wrong, right? But again, humans are not perfect. So sometimes after a very long process, we tend to make a little bit of error. But that error, if it goes to the patient and make the wrong prescription, it could kill the patient or endanger the health of the patient. So that's why we develop an AI platform that learn from the past billions of prescriptions. And then we look at all the prescriptions that is being prescribed right now, and then we pick up the medication that's unexplainable, meaning the drug should not be here. For example, if you're prescribed insulin, but you don't have diabetes, then it's unexplainable why the insulin's there, right? So that's how this medication error machine, AI machine, actually works.
Dr. Chang, how well is Taiwan positioned in this very exciting industry?
I think Taiwan is in a very unique position in the healthcare industry. The first, First of all, is that we have a very strong ICT industry. You know, things you talking about the AI, how to make it happen. Actually, you need, you know, device maker. You also need a server maker. You also need all kind of technology, in the order to enable to make such services possible. All this technology are from ICT industry, and that is one thing. The other thing is that we need someone who really understands medicine and healthcare. And so, you know, Taiwan is, you know, the medical system is one of the strongest, you know, industry in the world. And also we have very unique single payer systems that, you know, that centralize almost all our healthcare data in a single, you know, database. So it created many imaginations about the future, because if, you know, data is the future assets to make everything happen, then first of all things, you need a very systematic way to collect the data. Then you can go through, you know, machine learning and other process to make the AI possible. And so there are many things, you know, which are very good in Taiwan. Once everybody have a new idea, Taiwan understand how to make it happen. And also, Taiwan is, you know, healthcare and medical systems can also offer a very good, you know, environment to pilot run and to test all these, you know, new innovations, which is also very important, because healthcare business is an evidence business. You have to create evidence first. So I think these are all the, you know, the advantages that I see, you know, in Taiwan.
Dr. Lee, Taiwan does have all these advantages. And yet, when we look at Newsweek's, an example, Newsweek has a ranking called World's Best Smart Hospitals. You know, the Taiwan ranked behind, this is done by hospitals, individual hospitals, ranked behind Japan's and South Korea and Singapore. We come in at 254 with Taichung Veterans General Hospital. So why is this?
Well, one of the reasons is that we tend to promote less internationally. Although many of our hospitals, especially those 20 big teaching hospitals, they have done a lot. I would have to say it's amazing pace.
You mean ranked 1 to 20 on the list?
No, I mean the 20 larger hospitals in Taiwan, they have done a lot in AI actually to make their hospitals smarter. But unfortunately, most of them were not in the list. One of the reasons is because we don't have a lot of international promotions. And in the past 2 years, because the progress were mostly in the past 2 years, which were kind of cut off from international communication. And so these experts, they have to nominate a hospital. But if they've never seen the hospital, it's hard for them to actually nominate it, right? So I think what we have to do is, one, we have to become more international, so we have higher visibility. And the second thing is, just like Ted said, we have to create more evidence. It's not just, Mom, I can do it, you know, not type of demonstration. We have a lot of that kind of demonstration, but we also need to provide more evidence and publish more papers about it, so we have clinical level evidence that we can show around the world that not only are we doing smart hospital where it's actually working. So I think if we really focus on that, we can soon get in a ranking system. Because I've seen some of the hospitals where we're not worse than them. We're actually better than them, but they're in a ranking system, but we're not. So I think if we can do those things, create more evidence, increase our international visibility, then soon we'll be in the rank. I wouldn't worry about it.
Okay, that's good news. Dr. Chang, so Dr. Lee says more evidence, and perhaps it would help us to also take more of the international market, perhaps. This is a market that, from the figures, 2022, $5 billion US. But the key thing is that it's going to grow 30% every year to 2032 to become $70 billion US. You know, if we were to compare, you know, another fast-growing area, say like electric vehicles, that's projected to grow 17%. So this is phenomenal, isn't it?
Yeah.
Do you think that Taiwan has a lot more potential to be able to take of this international market?
Yeah, I think before I answer your questions, I would like to echo what Dr. Lee just said. Last year, I was assigned as the co-chair of Digital Working Group in APEC Business Advisory Council, which is very focused on digital health. You know, there are 21 economies in APEC, and they are all, they are all many well-established, countries like United States, Russia, and Japan and Korea. But it is me to take care of that role. One of the things that we have done is that we try to make sure that, to show the leaders that what AI can really help medicine in a real, practice. And basically, the Taiwan hospital contribute a lot in that. So one of the things we have to do is that we have to let people understand what kind of, real problems that we can provide, affordable solutions to make it happen. And this kind of, a promotion is quite popular and welcomed by other, countries. Like people are, looking for, the telemedicine solutions, but they don't know that Taiwan has it already. And already in Taiwan, many companies already implemented the solutions in the real, the situations. And so that's something that we have done, in the past 1 year. And we will continue to do that this year. And second, to echo your questions about the future market, I think the healthcare or medical industry is being redefined by AI and ICT, which means that the number you have seen is that more and more medical certified server, computer, or even medical grade IoT, or new algorithm, or software as a medical devices is coming in this market. So the most important thing is that you have to demonstrate that you can really solve the problems by providing solutions. Just like Dr. Lee, the problem statement is clear, the solution is there, and we can solve the real problem based on the systems. And so it's a future, and this is the reason why in Taiwan so many ICT companies is working closely with the medical field, the medical doctors, try to understand the real world problems and also the real world data, and to come up with the real world solutions that people really need. And that's something that we have to be very, very focused on. Yeah.
Dr. Lee, is it difficult for Taiwan? We are focused on this in many different areas. Our voice, our international standing, this is also a factor, isn't it, in being a barrier to other countries, knowing in depth what Taiwan can offer.
Yeah, absolutely. So that's why I think we should publish more, and we should invite more international scholars to visit our hospitals, host international exhibitions, conferences, and attend international organizations like APEC, as Ted just described, and let them know that this is not just it's not just Taiwan. These are the technologies that can readily be applied to other countries as well.
But that Taiwan can help.
Yes.
Oh, exactly.
Yes.
Yes.
Yes. Yes.
Now, let's look at one application for AI, skin cancer. In the US, more people are diagnosed with skin cancer than all the other cancers combined. When detected early, the 5-year survival rate for melanoma is 99%.
Skin cancer is mainly caused by overexposure to sunlight, which contains harsh and damaging UV rays. It usually appears as a new or changing spot on the skin. This spot can look like a mole, a pimple that doesn't heal, or a patch of rough skin. One sign of skin cancer is a new spot or growth that suddenly appears. A mole that changes size, color, or shape over time can also indicate skin cancer.
Dr. Lee, one of your companies offers an app that will assess skin moles for skin cancer. Tell us how this technology works.
Yes. Well, actually, it's based on my own experience that I do have patient who comes in and doubted that he or she will have skin cancer. So he requested that I check all the moles on his body. So it would take like 15 minutes, 20 minutes to check all the moles. And then when I tell him, oh, there's nothing wrong with these moles, he's kind of disappointed. And
he didn't believe
then
you.
Why am I here? You know, I'm totally wasting my time. He said he's wasting his time. And you know, I also waste my time too. But I also have other patients who came in with a very advanced lesion, and I would ask her, why do you come in so late? What's holding you behind? And she said, oh, I want to see a doctor, but you know, I would just maybe next week and then next month and then next year, and I never get the chance to see it. So now I have a vacation, so I come, but then it's a little late. So because skin lesion is something that people tend to ignore, and they don't want to spend 3 hours or half a day and then, you know, leave their job and leave their home and go to see a doctor. So it can easily be ignored and become something that's much harder and more expensive to treat. That's why we developed something called MOMI, so we focus on the AI that everybody can use. So you don't need a skin expert, you don't need a dermatologist to take the photo for you, and you don't need any specific tool. You can just take a photo with any smartphone, with any resolution. And then we would look at, the AI will look at it and well, not diagnosis, but it will give you a recommendation of the risk level. So we did not tell you that it's a cancer or not, but we tell you that the risk is above average and you probably want to see a doctor soon. Or it's lower than average and you can keep following up, meaning you can take more photo later until the risk is higher, then you go to the doctors. And since we published this application, it's been used 150,000 times in Taiwan. We hope that we can promote it internationally someday, but even in Taiwan, it's been used for quite a few people.
And do you have any figures about, you know, how many people maybe that you've managed to detect early and saved?
That's a very good question. I do have a lot of friends and students who work in plastic surgery, and they told me they've been seen many patients that recommended by the app to see them, to do further examination. And we did capture several very early melanoma, stage 0 melanoma, which can be totally cured by excision. So we're very happy that we have helped some of the patients so they can stop their disease, their melanoma early in the stages.
So, Dr. Chang, is there also this idea, the shift to self-care that is also enabled by AI?
Yes, I think that is one of the very important domains, because we don't want all the potential patients to go to the hospital directly. And basically, you know, that AI could be a very, you know, present very important role for self care at home. But by using very, you know, commoditized, you know, consumer products, you can achieve to certain level of, you know, I cannot say diagnosis, but they can tell you some risk assessment of some symptom. And that is good enough to reduce the loadings of the hospital. Yeah.
Dr. Lee, so to conclude, what do you see as the future of the medical system? Can you paint that picture?
Well, I think most of the currently developing AI are for physicians, for clinicians, for the hospital, medical professionals to use. But I think the future, we will probably going to focus more on the patient and the consumers, so it can be early. I think AI has a very, just like you said, early melanoma is totally curable and treatable, and it's much less expensive, and you have much better quality of life, right? So if AI can make healthcare earlier, I think that's that will be the key contribution.
And Dr. Chang, if we can end on the metaverse, because this is something that you are researching, are working with. Can you tell us, how the metaverse can be used with AI for healthcare?
Just like AI, metaverse is not a new term. And basically, that in aerospace industry, we have used metaverse or digital twin for for decades.
Right.
But the difference is that we use traditional, system, or analytics way to analyze the model of the machines. But right now we use neural network as the model to understand more about human being and to create a digital twin of a person.
So it's a little bit like how doctors used to work on dummies. Is that right? Except the dummy now is virtual.
But it's virtual and digital. But it's also based on the real, real world, data to create a model of your organ, your heart, and to understand the dynamics or behavior of your heart. And the second thing is that we talk about telemedicine. Inside Quanta, we have two different systems. One is to connect hospital to hospital, to bridge the skill and distance divide and also the capability divide, to create a virtual hospital with all expertise inside the cloud. That is one thing. The other thing is that when we move the point of care to your home, we actually are creating a virtual world in your home because we are talking about hospital at home. But there is no real hospital at home. But through AI and IoT and also connectivity, we try to make it happen. So everything virtual can be further, visualized to create an immersive, the environments through computer visions and through the AR, VR glasses to create a new interaction for the physicians and also the patients, which means that they don't really need to go to the hospital, but they still can enjoy, the touch and care, and also the professional, medical cares from the hospital, and that is the visualization of the virtual world, and you can view that as, a metaverse. So metaverse could be your body, metaverse could be a venue that you created, that you try to visualize. It's not just about social networking for us.
Not gaming.
No, it's not only about gaming, but because you are dealing with the real problems using the real world data. Yeah.
That's fascinating.
Yeah.
Thank you so much, Dr. Chang and Dr. Li, for joining us today on Talks. The biggest health supplements brand in Taiwan is a company known as Grape King. I sat down with its CEO, Andrew Zheng, to find out the impact of COVID on people's buying patterns. Andrew Zheng, welcome to Taiwan Talks.
Thank you. Thanks for inviting me.
So COVID-19 has transformed the biotech industry. And from your perspective within the biotech industry, can you tell us about those changes?
I think for the pandemic, for the past 2 years, the whole industry has changed a lot. And especially the demand for for us, we are doing the health supplement, and then we see a huge demand. And actually, according to the Taiwan Food Industry Research and Development Institute report, in 1992, the Taiwan health food market reached 160.8 billion NT dollars in 2021, and which is higher. It's increased. The growth rate is about 6.2%. So we can see there are more and more people are more aware of their for biotech, health supplements, or the healthcare, these type of things. And not just in Taiwan, we see it globally because we also do ODM. So we see more and more demand from overseas clients and asked to do some product focusing on boosting the immune system or such as probiotics, these type of products.
So boosting the immune system and probiotics, these are the most popular ones both in Taiwan and globally. And is that a change from, was that the same before the pandemic or has there been a change?
Actually, before, there are two categories. One is the immunity one, the other is the gastro health. And gastro health is actually more related to probiotics. And so probiotics, actually before, it's quite a big demand, but in some Southeast Asian countries, for example, like Thailand, Malaysia, Indonesia, that time a lot of people still, didn't know much about what probiotics are. But after COVID, and actually we don't need to do much education, and you just, a lot of people actually ask us to do probiotics for them. I think it's because 2020, there was a report from China saying that probiotics can help to fight COVID. So that report actually, got a lot of attention from the, Taiwanese market and Southeast Asian market.
So you mentioned the markets in Southeast Asia.
Yes.
Do you have markets further afield, say like in North America or Europe? And how does your company and maybe other Taiwanese brands, how do you compete with the other brands that are on offer in those markets?
I have to say, for Taiwanese brands, still not easy to compete with the international brand. But for raw materials, I think we do have some strong, quite a strong advantage to compete, focusing on the culturally cultivated ingredients. For example, if you look at the some raw materials like gluten or UC2, those we can't really compete. But if something like based on Chinese traditional herbal remedies, for example, like Antrodia, I don't know if you know, it's about Zhangzhi, Antrodia, the mushroom base, Denodoma, and Cordyceps, these type of things. And that type of raw materials are actually more well known in Southeast Asia because there are a huge population of Chinese people.
And what their raw materials to make what end product?
Focusing on the boosting immune system, and with the Antrodia, it's protecting your liver. Like probiotics for your gastro health. And some other cordyceps is also for your immune system cell. So these type of things, I think for Taiwanese, our strengths mainly focusing on the efficacy and quality. And also, that's why I think Southeast Asia is more convenient because the distance and tax. So like last year, I saw a report. I think Southeast Asia accounted like 40% of the Taiwanese export countries, like 40%. It's quite high, which means Taiwanese health food are more attractive in this region.
Do you see that in the West, there are more consumers who are wanting to try the Chinese medicines?
Yes, actually, it's not just the Chinese medicine. I feel that in general, the health supplements. Because before the Western countries, the consumers there, they try more about vitamins.